Imagine sitting in a waiting room thinking you're doing the right thing. You're over 70, being proactive about your health. But what if I told you some medical tests done after this age can actually bring more harm than good? Tests that may cause stress, lead to unnecessary surgeries, or even trigger complications you didn't have before. It's not about fear, it's about awareness. Most seniors walk into clinics trusting that every scan or exam is essential. But new research and experienced doctors are now saying some checkups should be avoided unless strictly necessary, especially in older adults, because the risks can outweigh the benefits. Certain screenings expose you to radiation, invasive procedures, and emotional shock that may do more harm than the condition they're trying to find. And the worst part? These tests are often prescribed out of habit, not because your body actually needs them. That's why this conversation is so important right now. In today's video, I'll show you 5 health checkups that may be dangerous after 70, and when they should actually be used. If you care about your health, independence, and quality of life, this is something you and your family need to hear. Let's protect your well-being with clarity, not fear. One of the most overused and risky tests after age 70 is the full-body CT scan without symptoms. Many seniors request it just to be sure, thinking it will catch hidden cancers or problems early. But what they don't realize is that this scan exposes the body to high levels of radiation, equivalent to hundreds of X-rays in one go. That amount of radiation can damage cells and increase your lifetime risk of developing cancer, especially if repeated over time. Worse, these scans often pick up harmless spots or incidental findings that look suspicious but are not dangerous. This leads to anxiety, unnecessary biopsies, or even surgeries that could have been avoided entirely. At this stage of life, your body needs less stress, not more. If you feel fine and have no clear symptoms, a full-body scan is more likely to harm than help. Doctors now recommend against it for routine checkups unless there's a specific reason or strong family history that justifies the risk. Let's look at Shirley, 73, from Denver. She felt perfectly healthy, but decided to get a full-body scan offered in a mobile clinic. The scan found a tiny lung nodule. After a stressful biopsy and a painful recovery, results showed it was benign. Her doctor later said the scan should have never been done without symptoms. If you're concerned about something specific, like persistent pain or family cancer history, talk to your doctor about targeted tests, not whole-body scans. There are safer imaging tools like low-dose CTs or ultrasounds, depending on your situation. The key is to avoid scanning, just in case. Because at this age, protecting your energy, sleep, and peace of mind is as important as protecting your body. And in the next topic, we'll talk about a test that seems harmless, but can lead to misdiagnosis and overtreatment, especially in older men. Another test that raises concern after 70 is the PSA blood test for prostate cancer, especially when done without symptoms or history. While it sounds simple, this test often leads to false alarms, detecting slow-growing tumors that would never cause harm. Yet, once found, they often trigger aggressive treatment. The PSA test measures prostate-specific antigen levels. High numbers don't always mean cancer, and low numbers don't always mean you're safe. In older men, slight changes can come from age, infection, or even a recent bike ride. But once a spike is found, many doctors feel pressured to investigate further. This leads to biopsies, MRIs, and even prostate removal surgeries that can result in serious side effects, like incontinence or erectile dysfunction. For many seniors, the emotional and physical toll of this chain reaction is far worse than the slow-growing cancer would have ever been. Take Raymond, 76, from Tampa. He had no symptoms but was told to stay ahead with a PSA test. It came back slightly elevated. One test led to another, and within 3 months he was recovering from surgery. Exhausted, confused, and with regrets. His final diagnosis? A non-aggressive tumor that never needed removal. Today, experts say, if you're over 70 and not having prostate issues, think twice. PSA screening should only be done after a detailed conversation with your doctor, weighing risks versus benefits. It's not about ignoring cancer, it's about knowing which ones matter at your stage of life. And if you think that only men face this kind of overtreatment, wait until you hear what test causes similar problems for women after menopause. That's coming next. For women over 70, one controversial test is the annual pelvic exam with pap smear, especially when they have no symptoms and a history of clear results. After menopause, the cervix changes naturally, and in women with no history of cervical cancer or HPV, frequent screening can lead to unnecessary worry and invasive procedures. Medical guidelines now say that women over 65 who've had several normal pap results in the past decade no longer need the test. Yet many doctors continue ordering it automatically. The result? False positives, uncomfortable exams, or unneeded biopsies that cause more harm than peace of mind. The truth is, after 70, the chances of developing cervical cancer with a clear history are extremely low. What's more likely is that the exam finds benign changes, like thinning or dryness, that look abnormal but aren't dangerous. Still, they can trigger fear and even unnecessary surgeries. Let's take Deborah, 75, from Portland. She had always done her checkups regularly and never had issues. But one postmenopausal exam led to a concerning result. A biopsy followed, and days of stress. Turns out it was harmless tissue change. Her new doctor told her the test should have been stopped years ago. Now, this doesn't mean ignoring symptoms like bleeding, pain, or discharge. Those should always be checked. But for healthy women with a clear screening record, repeating pap smears late in life can bring more tension than benefit. It's about smart screening, not over-screening. Have you ever done a test just because it was routine, without really knowing if it was needed? Many seniors do. But now is the time to ask more questions, and in the next topic, we'll look at a heart test that sounds helpful, but can cause major complications. The next checkup to be cautious with is the stress test for the heart, especially when done as a routine screening without symptoms. This exam, often involving a treadmill and heart monitors, is designed to detect blocked arteries. But in seniors over 70, it can cause more stress than insight. When the heart is pushed during the test, it may trigger arrhythmias, dizziness, or even chest pain. Not because of disease, but because of natural age-related changes. And even when results seem abnormal, they don't always point to something serious. But the fear they cause can lead to unnecessary stents or even open heart surgery. Modern cardiology now advises, don't do stress tests unless you have symptoms like chest pain or shortness of breath. The risk of finding something abnormal that doesn't need treatment is high, and once found, it's hard to ignore. Doctors often move forward just to be safe, even if the test wasn't truly needed. Walter, 78, from San Diego, is one example. He felt fine, but was convinced to do a routine stress test. It showed a slight irregularity. That led to an angiogram, then a stent, then a long recovery. Looking back, his cardiologist admitted the initial test wasn't necessary, and likely started a chain of overtreatment. Instead of broad testing, seniors should focus on lifestyle markers, walking stamina, blood pressure, and resting heart rate. If something changes, then testing makes sense. But pushing the body just to see what might happen? That's a risk few seniors truly benefit from. And yet, many still do it, thinking more testing means better health. In our next topic, we'll reveal the final checkup that sounds helpful, but can bring pain, false hope, and even long-term complications if misused. One of the most misunderstood and potentially harmful tests after 70 is the colonoscopy, especially when repeated too often or done without a valid reason. While this exam can save lives when used properly, its routine use in seniors can lead to more harm than protection, particularly due to sedation and risk of complications. Colonoscopy requires anesthesia and bowel prep, both of which are harder on aging bodies. There's also a higher risk of intestinal tears, bleeding, or adverse reactions to sedation in older adults. For someone frail or with other conditions, the recovery can be difficult and sometimes unnecessary. Medical guidelines now say that if you had a clear colonoscopy in your 60s and no family history, you may not need another after 75. But many clinics still recommend them automatically. And when small, slow-growing polyps are found, patients are rushed into removal procedures that may not have been needed at all. Let's look at Maria, 79, from Chicago. She felt pressured to get another colonoscopy, even though her last one was clean. The prep left her dehydrated, and she fainted the morning of the procedure. The result? No findings. Her doctor later said that with no symptoms, the test could have been safely skipped. Here's the alert. Doing procedures just to be sure at this age can create risks that were never there before. The goal is no longer to scan everything, but to protect your energy, minimize risk, and focus on real signs your body gives. That's how you live longer and better. In our final topic, I'll show you the one thing you should do after 70 that most people ignore, and it might just be your best protection yet. Instead of chasing unnecessary tests, seniors over 70 should focus on something often overlooked: an annual functional wellness check. This isn't about machines or labs. It's about how well your body moves, thinks, and recovers. Doctors call it a functional assessment, and it can predict future health better than any scan. This check includes walking speed, grip strength, balance, mental clarity, and ability to perform basic daily tasks. It gives a full picture of how you're aging, not just what's inside your arteries or organs, and it helps doctors recommend real actions: nutrition, movement, sleep, before things decline. One simple example: a 10-second balance test on one leg. Seniors who struggle with it often have higher risk of falls and even mortality within 10 years. But the good news is, this kind of weakness can be reversed. Unlike many test results, you can act on this and see real progress. Take Gloria, 75, from Austin. Her doctor skipped blood work and instead asked her to walk 10 feet and stand from a chair without using hands. She struggled. That moment led her to daily leg exercises, protein adjustments, and mental focus games. 6 months later, she felt younger and more independent. These simple evaluations don't involve radiation, sedation, or stress. They reveal your strengths and risks through action, not machines. And they align with your real goal after 70, not just surviving, but thriving with energy, confidence, and clarity. So next time you go to the doctor, ask, "How's my function?" Not just my numbers. That question could protect your freedom more than any expensive machine ever could. After 70, your health shouldn't be managed by fear or routine, but by wisdom. Not every test brings clarity. Some bring confusion, risk, or exhaustion. That's why understanding which exams help and which to question is one of the most powerful things you can do for your body right now. You've earned the right to live with confidence, not constant monitoring. Your time, energy, and peace matter. The best medicine often is listening to how you feel and staying strong where it truly counts: movement, clarity, and independence. If this video opened your eyes, leave a like and share it with someone you care about. Comment below: have you ever done a test you later regretted? And don't forget to subscribe for daily tips that protect your freedom, strength, and joy after 60.